Okay, yeah, welcome to the information session. This is for the online certificate in health terminology standards. It's offered by the School of Health Information Science at the University of Victoria. My name is Simon Minchell. I'm the faculty coordinator and assistant teaching professor within the faculty. So good to have you here. We'll begin by formally acknowledging the First Nations traditional territory. So I'd like to state that we acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose traditional relationships with the land continue to this day. Okay, so in the next 15 minutes or so, I'm going to give you some information on the certificate program, and I'll let you know how it could possibly help advance your career. So please note as well, like I said at the beginning, we're recording the presentation portion of this section, but not the Q&A that follows. If you have any questions during the session, please either raise your hand and I can just maybe try to answer them right away, or type your question into the chat bot and we'll address them as soon as possible. Okay, so, sorry. What is the certificate program? Well, in 2018, our school introduced this certificate program in health terminology standards. And more recently, in collaboration with the Division of Continuing Studies, the school offers a professional stream in the certificate program. Okay, admission to the program, one stream or the other, requires that you either have a 4-year baccalaureate degree, such as a Bachelor's of Science, or 2 or more years of related work experience in healthcare. So the certificate is a 1-year part-time program with 4 courses of weekly online classes and 1 virtual workshop. The virtual workshop takes place over about a week, and it's all done online. Students who graduate from the certificate program will be eligible to apply for the Certified Terminology Standards Specialist Credential. This is called the CTSS, and it's issued by the Canadian College of Health Information Management, or the CCHIM, which is part of CHIMA, the Canadian Healthcare Information Management Association. So I know there's a lot of acronyms in that, but the CCHIM and CHIMA really, in many respects, are the same organization. Okay, they are a professional membership organization, and they have 4,000 practicing health information management professionals across Canada. Okay, there's the blurb on the CTSS. This presentation is, once it's recorded, we're going to post it online and you'll be able to review this at your leisure. Okay. Sorry, I'm kind of losing my track where I am here. Okay, here's an overview of the program. Now, this program is jointly delivered with industry partners, such as Accenture, CIHI, the Canadian Institute for Health Information, RKL Informatics, Ontario Health Digital Health Standards, Canada Health Infoa, and many other industry leaders in the fields of health information standards within Canada. Okay, so there's 4 courses to the program. The first course is HINT 535, and it's about health information standards, a survey course in the area. It's done over 13 weeks, beginning in September. The 4 courses roll throughout the 4 years, throughout the whole year. They begin in September, that they end in August. Okay, so the first one runs September to December. Okay, the course introduces you to various different types of terminology standards, not only for capturing clinical events such as diagnoses, findings, assessments, and medications, but also it covers data exchange standards, standards that are used for exchanging patient information from one organization to another, using electronic messaging and documents. Okay, the courses will feature hands-on learning activity and term papers so that you can apply the concepts you learn during the class sessions on your own time. The course is co-taught by subject matter experts from Accenture and CIHI. Okay, so that's HINT 535. The next course in the series is 536, and this one runs from January to April, the winter session or spring term. Everything seems to be named 3 separate times. This one is on specifically focusing on controlled terminology standards, and it's also done over 13 weeks. And in this course, you'll be learning more about specific health terminologies such as SNOMED CT, which is a reference terminology for diagnoses, clinical findings, body sites, organisms, and really, to be honest, pretty well anything you can express clinically in terms of healthcare, you should be able to encode with SNOMED CT. It's a powerful standard, and it takes a whole course to really cover it in depth. You'll learn how to use these terminologies by doing things like creating subsets, making extensions, using cross maps, or querying patient records. You'll also learn how to implement and support these technologies in healthcare organizations. Okay, this particular course, HINT 536, is taught by Dr. Dennis Lee from RKL Health Informatics. Dr. Lee is a graduate of our school and a practicing, well-regarded health terminology specialist. So that brings you to April. And with a very short break, we begin a compressed summer term, where during the entire summer term, 2 courses are taught in a compressed format, so you can get as much learning as possible. Okay. 537 is a course on health information exchange standards. And again, it's taught over in a compressed format over a 6-week period. So in addition to weekly online classes, in May, there is, it's often in May, it's not written in stone, but there is often a virtual workshop where you have an intense week of learning and reading and writing. Okay, of course, we'll introduce you to real-life standards-based healthcare applications and case studies for immunizations, medication, imaging, lab tests, clinical reports, and so on. The emphasis for this one is on the appropriate use of terminology standards in healthcare applications. Okay, the last one, also done during the compressed summer term, is the Capstone or field project, and you complete this over 3 months from June to August. Your field project in the Capstone course will allow you to apply everything you've learned thus far into one body of work. Okay, it's intended to be a practical project. And what you do exactly for your project, you'll have to negotiate that with your instructor during the course, they're a very helpful bunch to be well taken care of there. Okay, so I've got a couple of examples of field projects to show you. So you've studied all this stuff for 3 terms, and finally you're at your capstone. Here's a couple. I won't read them all, but one would be to identify the requirements for a specific terminology for healthcare organization use. And if you happen to work in the area, it's perfectly acceptable in most cases. You have to be aware of privacy, but in most cases to focus on this stuff and apply your knowledge to what you do at work. Okay, another one is to develop specifications for structured data entry or retrieval template. These don't necessarily need to be completed systems, but they should be substantive in nature. 4th one, mapping local drug terms to the Canadian Clinical Drug Database. A very specific set of requirements in that one. There's a few more here. The last one, you could do a more traditional approach as a literature review and conduct that to evaluate, say, a terminology's impact on quality of care or something like that. So yes, if any of this appeals to you, then you are certainly in the right information session. So what do you do with this knowledge? I suppose this is a good time to remind you, I left myself a reminder at the beginning of the slide deck that we are the Health Terminology Standards Graduate Certificate Program, and we've recently engaged into a name change. We're now going to be calling it the Health Terminology and Interoperability Standards Certificate Program. It's got various versions of the name. That's why this says HTIS up there. Okay, so how can it help your career? Well, it will allow you to get the CTSS certificate. And if you look for standards-based employment opportunities or situations vacant around the country, you'll find that this certificate is in demand. Okay, you could become the go-to person for implementing standards for health information exchange or electronic health record projects, or generally you could be the go-to person for terminology standards within your organization. This certificate program is quite intense, and there's a lot of learning that happens. Okay, here are three examples of recent initiatives in Canada. We've got the InfoA standard resources for COVID-19. I like this as an example for standards because a couple of, or 3 or 4 years ago, there was no COVID-19. And so suddenly we were hit with this pandemic and we need to record all of this information regarding COVID-19 within our healthcare systems. How do we do that in a standardized manner? Well, the very first thing you had to do, well, that InfoA got involved in, is creating new extensions for COVID-19, for example. Patient summaries, Canadian specifications for that is a recent use of standards, particularly in the long-running pan-Canadian electronic health record, which hopefully will be available within the next decade. Okay, and the last one, digital health information exchange regulations as well. Okay, so standards is a big field in Canada. So I got a couple of slides here showing examples of recent alums and what they do. These have been anonymized and the pictures are fake, just so you know. The first example, sorry, I've skipped a bunch of stuff. Here's our recent alum. She's now a management consultant working for industry. And we asked her, why does the UVic certificate, why did it appeal to her? And she said it offers a deep dive into health terminology standards, such as SNOMED and LOINC. It filled in knowledge that she didn't have before taking it. It bridged the gap between technical and non-technical world. If you work in the knowledge sector, this is a key skill. And it allowed her to work full-time while studying. Okay, how did the program help her prepare for her current role? It provided a comprehensive understanding of health terminology and standards and exchange standards, and expanded her knowledge of FHIR, particularly with the Smart on FHIR. Here's another one, a nurse who is also a community coordinator, who's strongly interested in health equity. This is a very active area of research, doing things such as representing the social determinants of health as part of the electronic health record. Health information systems and exchanges are used for international, national, provincial, and other standards. As a nurse, he says, I understand that health equity and the values of the Canadian healthcare system, such as universality, accessibility, and so on, are not simply ideals. They are calls to action. So there's an activist stance going on here, which we love to see. Through standards work, he can bring his voice to the marginalized and help create the conditions for equity by working to ensure that our system and its structures are inclusive. Okay. Moving on. So that was a bit of a whistle-stop tour through the standard certificate program. Where do you get more information? Primarily, your first stop would be the UVic's Health Information Science webpage, and there's a subpage in there about our certificates, and this one is included in there. If you're wondering, do I fit in this in the graduate stream or the professional stream, there are links from the main page that get you to both. Likewise, you could visit continuing studies at UVic to see our certificate program and all the other certificates that they have available there. Okay, the web address is down here, and it's also in the emails that you received that got you here to this session. So feel free to dig a little bit deeper. There's quite a bit of text on both, but you can work your way through it. If you have any more detailed questions, please feel free to reach out to myself. You should know that if you're interested in joining the program in September, the deadline for your application is June the 1st. So keep that in mind. I'm Simon Minchell, HTIS Coord, as you see it on the screen at uvic.ca is my email address. You can reach me there. The certificates webpage at the school is at this address, and you'll find all kinds of information there, including quite likely the link to this video will be on there. Also, the program review overview is there, admission requirements, how do you apply, what are the fees, and so on. That's all there as well. If you want to know more about the CHIMA's the CTSS certificate, a very simple web address there. Click that at your leisure, and you will read much more about it. That's what we have, folks. So thank you for being here, listening to this. I am going to stop the recording.